given the frequency with which you said that Alzheimer's is misdiagnosed or undiagnosed, how important is it for somebody to get a second opinion when they do get diagnosed, or if they get some other diagnosis and they feel like they're having some kind of memory issues?
I think our brains are the most important things we have. It's what makes us an individual. It's what allows us to plan and think about our lives and remember things. And if we are having problems with the way we're thinking and the way we're functioning, and we believe it's from the brain, then we absolutely, and we're not happy with the opinion we got from our physician, either a physician saying, oh, don't worry about it, I have memory problems too, or saying, well, this is Alzheimer's and you don't believe you have Alzheimer's, or they tell you it's perhaps something else, you absolutely should get a second opinion.
And even if you believe it, you had a story in the book about somebody who were diagnosed with Alzheimer's, they believed they were Alzheimer's, they were treated as such, and then in the end didn't have it. And it ended up being, I think, a hormone treatment that cured her.
Right. So women in their 40s into their 50s have problems that look identical to people who have Alzheimer's. So they have trouble finding words. They can't multitask. They have trouble with short-term making memory. They have trouble with remembering things. They become irritable. And so those all mimic the early symptoms of Alzheimer's. Right. And not every woman does. It's just the rate is similar to people having hot flashes, say.
The ones I knew do.
Yeah. But it's a very scary thing, because
right.
women mostly get to, at that point, they're kind of at the highest levels in their career. Many of them get there because they are articulate and well-spoken, and suddenly they're having trouble finding words. And so unfortunately, at very many memory disorder centers, people don't yet know to ask, well, are you going through menopause? Are you having trouble with change in your period? And so they can be misdiagnosed as having Alzheimer's. And I found that out early in my career because I made the same mistake. I was at a memory disorder center and I diagnosed a woman with Alzheimer's, and it turned out she had menopause-related memory loss. So I learned from that mistake, and I try not to ever do that again.
Unless you don't ask that to a man, though. Real quickly, if somebody wants a second opinion, they should not feel embarrassed to say to their doctor they want to get a second opinion. Is that correct?
That's absolutely true. Your doctor and you should be partners in keeping you healthy. And they should not feel threatened if you say you want a second opinion. And if they do, you should get another doctor.
And is it a good strategy to ask the first doctor for a recommendation for a second opinion, or to find it on your own?
I think it depends on your trust level with your physician. There are physicians very many physicians really do care about their patients, and they're going to try to help the patient the best way they can. There are some times where, there isn't that rapport, and then perhaps you want to get some other opinion on your own independently. But most of the time, I think it's fine to discuss with your physician, and don't ever feel guilty about hurting your doctor's feelings. That's not why you're there.
No.
You're there to get better.
You're the patient.
Yeah.
You're in charge.
Yes, absolutely.
Great.
Yeah.
All right. Thank you. If you like what you just saw, come to our website. We have many more videos with Dr. Devi. You can buy her book too, The Spectrum of Hope. Here's mine. It's all dog-eared because there's so much important information in it about the new learning and understanding about Alzheimer's. And do me a favor, do that social thing. Let other people know about these very important videos. Come to our website, bottomlineinc.com.